Joe be trapping.
Check with your doctor or nurse for more information. Everyone who have RTBY need to know the symptoms of the TB. If you develop symptoms of TB disease, you should see a doctor right away. People sometimes need help managing the RTBY medicine they must take. The CDC has developed RTBY medicine takers to help patients organize and manage their RTBY medicine. On this medicine tracker, there is a space to write treatment, medical intake, and doctor, clinic contact information, signs and symptoms that may develop while taking medical. There are 3 medicines that are tracker. 1. Dose regimen for rented TB infection, medicine and symptoms. Secondly, 4-month daily rifampin 4R. Thirdly, 3 months of daily isoniazid plus Lafin 3HR. To learn more about that, we see treatment regimen for TB decline when the TB to be treated. That's it.
Okay, what if I have HIV infection?
If you have HIV infection and related TB infection, you need to treat as soon as possible to prevent TB disease. A person with HIV infection who also untreated TBI is much as more likely to develop TB disease during his or her lifetime than someone without HIV infection. Among people with RTBY, HIV infection is the most strongly known as the risk factor for progressing to TB disease. All people with HIV infection should be tested to find out if they have TB. We seek treatment if necessary. There are several infects treatment available for the people with HIV.
Okay, if I was exposed to someone with TB disease, can I give TB to others?
If you were exposed to someone with TB disease, you may become infected with TB bacteria, but you would not be able to spread to bacteria to others right away. Only people with infected TB disease can spread TB germs to others before you would be able to spread TB germs to others. You would have to breathe in germs and become infective. Then the TB germs would have to multiply in your body and cause infection, TB. At the point you could possibly spread TB germs to others. In most people who breathe in TB germs and become infected, the body can fight the germs to stop them from growing. The germs become inactive but they remain alive in the body and can become active later. This is called latest TB infection. People with TB cannot spread TB germs to other people who have other TBI can be treated, prevented TB.
Okay, how is TB disease treated?
There is good news for people with TB disease. It can almost always be treated and cured with medicine, but the medicine must be taken as directed by your doctor or nurse. If you have TB disease, you will need to have several different TB medicine. This is because there are many TB germs to be cured. Taking several TB medicine will do a better job of killing all of the TB germs and preventing them from becoming resistant to the medicine. Resistance meaning that the medicine cannot longer kill the TB bacteria. So, if you have TB disease of your lung or front, you are probably infections, you need to stay home from work or school so that you don't spread TB germs to other people. After taking your medicine for a new week, you will feel better and you might no longer be infectious to other. Your doctor or nurse will tell you when you can return to work or school or visiting friends. Having a TB disease should not stop you from leading normal life. People who are no longer infection or feeling sick are often able to do the same thing. They did not become they had TB disease. If you take the medicine as directed by your doctor or nurse, they should kill all the TB germs. This will keep you from becoming sick again.
Okay, why do I need to take TB medicine for so long?
TB germs die very slowly for the treatment of a late TB infection. It takes at least 3 months, possibly longer, development of which medication you are on to kill the TB germs. For TB disease, it usually takes 6 months or longer for the medicine to kill all the TB germs. You will probably start feeling well after only a few weeks of a treatment, but beware, the TB germs are still alive in your body. Even if you feel better, you must continue to take your medicine until all the TB germs are died. Even though you may feel better and have no more symptoms of TB disease. It can be very dangerous to stop taking your medicine or not to take all your medicine regularly. The TB germs will growing again and will remain sick for a long time. The TB germs may also become resistant to the medicine you are taking. You may need new different medicine to killing the TB germs. If the old medicine no longer to work, their new medicine must be taken for a long time and usually have a more serious side of health effect. If you become infection again, you could give TB germs to your family or friends, anyone else who spend time with you. It is very important to take all your medicine and directed by the doctor or nurse.
Okay, what is directly observed therapy?
Okay, the best way to take your medicine is to get directly observed therapy. Dot. This is especially true for treatment of a TB disease. If you get it dot, you will meet with a healthcare worker every day or several times a week. You will meet a place you both agree on, or by electric method. Meeting in a person can be at least at the TB clinic, your home or work, or any other content location. You will take your medicine at this place while the healthcare workers wash. Sometimes TB programs now use electric method of a draught for both TB disease and latent TB infection, RTBI. Electronic dot is a alternative to in-person dot if a dot is available in your area. You qualify for dot healthcare workers. With wash, you take your TB medication. You qualify and remote over smartphone or other videos capable electric device, whether in a person using electric device, helping you remember to take your medicine and complete your treatment. This means you will get as soon as possible. The healthcare workers will also make sure that the TB medicine are working as they should. This person will also wash other side effective and answer any question you have about TB. Even if you are not getting dot, you must be checked regularly by your doctor or nurse at different times during your treatment to make sure everything is going well. This is continue until you are cured.
Okay, the last question.
Now,
How can I keep from spreading TB?
okay, the most important way to keep from spreading TB germs for people with infection, TB disease, take to all medicine exactly as directed by doctor or nurse. You also need to keep all your clinic appointments. Your doctor or nurse needs to see how you are doing. This often requires another chest X-ray or a test of your symptom. That is coughed up from deep in the lung. This test will show whether the medicine are working. Tests also help to show whether you can still spreading TB germs to others. Be sure to tell your health care provider about anything you think is wrong. If you are seeking enough with TB disease to go to hospital, you may be put in a special room. This room use air vent that keep TB germs from spreading to other rooms. People who work in these special rooms must wear a special face mask to protect themselves from TB germs. You must stay in the room so that you will not spread TB germs to other people. If you are infection while you are not at home, there are things you can do to protect others near you. Taking your medicine as directed, this is very important. Or always cover your mouth with a tissue when you cough, sneezing, and laugh. But the tissues in the closed back and front it away. Separate yourself from others and avoid close contact with anyone. Sleep in a bedroom as from other family members. Avoid having visitors in the home. And do not go to work or to school.
Okay, this is the end of our discussion for today. So I want to thank you for your discussion and commitment.
Okay, thanks.
Thank you very much.